Hello and welcome to Workers' Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So let's get started. Welcome to episode 9 of Workers' Comp Unwrapped. With me today is
Aisha,
who has 15 years of experience in the workers' comp industry, and today we are talking about
a time crunch.
the time crunch of land filings, why deadlines matter, and how to keep up. You've provided excellent care to an injured worker, meticulously documented everything, submitted your land, and then
Nothing.
crickets, nothing, no payment, no acknowledgement. It's like your claim disappeared into the ether. This, my friends,
Is a problem.
this is the potential fallout when a critical deadline is missed.
And it happens more often than you might think. Deadlines are the unsung heroes of workers' comp. They ensure the system operates smoothly and fairly for everyone.
Okay, so deadlines are important. Got it. But let's get down to brass tacks. What are the must-know deadlines that doctors absolutely cannot afford to miss?
The most crucial one is that initial lien filing in California for services provided on or after July 1st, 2013. You have 18 months from the date of service. Miss that window, and you're potentially waving goodbye to your payment.
18 months seems like a reasonable amount of time, but I can only imagine how things can slip through the cracks in a busy practice, especially when you're juggling patient care paperwork and a million other things. What else should doctors be extra careful about?
Proof of service is another critical step. You have to demonstrate that all parties involved in the case received a copy of the submitting. It's like sending a certified letter. You need that record for your protection, and if for some reason your lien is denied, you have a limited time to appeal, often a mere 20 to 30 days, depending on the jurisdiction.
So it's not just about filing, it's about filing accurately and being prepared to act swiftly if any issues arise. It sounds like a tightrope walk. Why is adhering to these deadlines so crucial for a doctor's financial well-being?
First and foremost, it's a legal requirement. Ignoring these deadlines can mean forfeiting your right to payment.
That's straightforward enough.
Exactly. On a more practical level, timely filings are the lifeblood of your financial health. They ensure consistent cash flow, which is essential for covering operational costs, paying staff, and investing in new equipment or technology.
And that consistent cash flow is vital for maintaining a healthy practice, right? It allows you to cover operational costs, invest in your staff, and potentially expand your services.
Absolutely. And let's not forget the impact on your professional reputation. Consistently meeting deadlines showcases your reliability and professionalism to insurers and other stakeholders. That kind of trust can be invaluable in this industry.
It makes perfect sense. So we've established that deadlines are non-negotiable. But has the landscape become even more demanding? Is there more pressure now than before when it comes to these filings?
The pressure is undoubtedly intensifying, and the margin for error is shrinking. One major factor is the increasing role of technology in claims processing.
This is where the role of technology gets interesting. While it's designed to streamline processes, it can also create new challenges for providers.
Think of it this way. Insurance companies are utilizing sophisticated systems to automate their processes. This means they can identify a late or inaccurate lien in the blink of an eye. Their systems are like digital detectives sniffing out any inconsistencies.
So no more flying under the radar.
Not a chance. They're also leveraging data analytics to detect patterns. If they observe a provider consistently filing late, they'll likely scrutinize your claims more closely.
So they're building a profile like a credit score for lien filing.
Precisely. And we're also seeing legal precedents that underscore the importance of deadlines. A recent case, Smith Medical Group versus XYZ Insurance, involved a lien filed just 1 day late, and the court upheld the denial that sends a clear message about how seriously these deadlines are taken.
1 day, that's a harsh lesson.
It is, and let's not forget, the ever-evolving regulations. Staying up to date with the latest changes in workers' comp laws can feel like a full-time job in itself.
All of this is making me a little anxious, to be honest. It seems like the stakes have never been higher.
To put it in perspective, a staggering 25% of lien denials in 2023 were simply due to missed deadlines.
A quarter of them, that's a massive amount of potential revenue slipping through the cracks. That's a wake-up call for every doctor out there.
To illustrate the impact, let's consider a real-world scenario. Imagine Dr. Jane Doe, a highly skilled orthopedic surgeon, treats an injured worker over several months, providing exceptional care and meticulous documentation. The bills accumulate, reaching $100,000.
Here comes the but, right?
She submits her $100,000 loan but misses the deadline by a mere 2 weeks.
2 weeks, that seems like a minor blip in the grand scheme of things.
You'd think so, but the insurance company denied the entire loan based on that 2-week delay, even after appeals the denial was upheld.
So all that expertise, care, and documentation, potentially $100,000 down the drain because of a 2-week oversight.
That's the reality, and this is just one example of how a seemingly small misstep can have major consequences.
This is pretty sobering stuff. Doctors are already facing numerous challenges, and now they have to be hypervigilant about these deadlines. It can feel like navigating a minefield.
It can feel that way, but it's important to remember that the system aims to ensure fairness and efficiency for everyone involved.
That's a fair point, but I think we've painted a vivid picture of the potential pitfalls now.
Yeah.
Let's shift gears and talk solutions. What can doctors do to protect themselves and ensure they never miss a deadline?
There are some incredibly effective strategies and tools available. First and foremost, get organized, implement a robust tracking system, think digital calendars, with alerts for upcoming deadlines, and consider investing in specialized lien management software that can do the heavy lifting for you.
Software that sends reminders and keeps track of everything. Where do I sign up?
Right. It takes a huge weight off your shoulders. Another crucial step is assigning clear responsibility. Don't leave it to chance. Designate a specific staff member to oversee the entire lien process and hold them accountable. And of course, training is key. Ensure your team is up to date on the latest regulations and best practices.
So a dedicated point person, the right technology and ongoing education. It's all about creating a system that minimizes risk.
Exactly. You also need to develop clear step-by-step procedures for every stage of the filing process. Checklists, regular audits, anything that helps eliminate errors and keeps things running smoothly. And speaking of eliminating errors, don't underestimate the power of technology for things like electronic filing and secure cloud storage. It makes everything faster, more efficient, and less prone to human error.
It sounds like embracing technology is essential for staying ahead of the curve in the ever-changing world of workers' comp. But staying current with all the changes can feel overwhelming, can it?
Absolutely. That's why ongoing education is crucial. Attending workshops, seminars, networking with other professionals, all of these can help you stay informed, and adaptable knowledge is power, especially in a complex system like workers' compensation.
Yeah, and it's not just about, like you said, being organized or tech savvy. It's recognizing that human toll these challenges can take.
And creating a culture of support within practices where staff members feel comfortable discussing their struggles and seeking help when needed. Exactly. And beyond the practice level, there are professional organizations and support groups, and even therapists who specialize in working with medical providers experiencing burnout and stress.
That's reassuring to know there are people who understand what you're going through and can offer guidance and support.
And remember, asking for help is a sign of strength, not weakness. It demonstrates a commitment to your well-being and the well-being of your practice.
I love that perspective.
Yeah.
It's a reminder that you don't have to be a superhero. You're human, and it's okay to struggle. Seeking support when you need it is a sign of self-awareness and professionalism.
Absolutely. And when you reach out for help, you're not only taking care of yourself, but also setting a positive example for your team. You're fostering a culture where vulnerability is accepted and support is encouraged.
That's such a powerful message. It's about shifting the mindset from, I have to handle this alone, to, we're in this together.
Exactly. And that sense of shared responsibility can make all the difference in navigating the complexities of workers' comp while preserving your well-being. So let's circle back to some practical advice. You mentioned lien management software earlier. Can you elaborate on how that can help providers stay on track?
Lien management software can be a game changer. Think of it as your digital co-pilot for lien filings. It helps you track deadlines, automate reminders, and even generate reports to identify potential bottlenecks in your process.
That level of organization and automation can be incredibly valuable, especially for busy practices dealing with multiple cases.
Absolutely, and many of these software programs integrate with existing electronic health record systems, streamlining your workflow even further.
So you're essentially eliminating manual data entry and reducing the risk of human error.
Exactly. And when you're dealing with crucial deadlines, that level of accuracy can make all the difference, but technology alone isn't enough, right?
Right. You also need a solid understanding of the regulations and procedures. What resources would you recommend for providers who want to deepen their knowledge in these areas?
There are some excellent resources available. Professional organizations like the California Workers' Compensation Institute offer workshops, seminars, and online courses covering a wide range of topics.
And those courses are often taught by industry experts who can provide real-world insights and practical guidance.
Exactly. They can help you decipher complex regulations, stay up to date on the latest changes, and even connect you with a network of colleagues facing similar challenges. Don't underestimate the power of networking.
Networking can be invaluable. It's a chance to share experiences, learn from others' mistakes, and get advice from those who have successfully navigated the system.
Precisely. And you might be surprised how willing people are to help. Most providers have been in those trenches and understand the importance of supporting each other.
It's a sense of camaraderie born out of shared challenges and a commitment to providing excellent care. And speaking of challenges, let's address another common issue that providers often face: denials. What are some of the most common reasons for lien denials beyond missing deadlines?
Incomplete or inaccurate documentation is a frequent culprit, tumbling. Insurance companies are incredibly meticulous when reviewing claims, and any discrepancies can lead to denials.
So meticulous record keeping is paramount.
Absolutely. Make sure your documentation is thorough, legible, and supports the medical necessity of the services provided.
And that includes everything from initial evaluations to treatment plans, progress notes, and billing codes.
Everything. It's also crucial to use the correct billing codes, which can be a minefield in itself.
Especially with the constant updates and revisions to coding guidelines.
Right. That's why staying current with coding changes is crucial. It's also essential to understand the specific requirements of the insurance carrier you're dealing with.
So you're saying that what flies with one carrier might not be acceptable to another?
Exactly. Each carrier has its own set of rules and procedures, and failing to adhere to them can lead to denials.
That adds another layer of complexity.
It does. But here's the good news. There are ways to navigate these challenges. Working with a billing specialist who is well-versed in workers' comp can be incredibly beneficial. They can help you ensure your documentation is accurate, your coding is correct, and your claims are submitted according to the carrier's specific requirements.
So it's about having someone on your team who speaks the language of workers' comp billing.
Precisely. They can be your advocate, helping you avoid costly denials and ensure you're getting paid for the services you provide.
And they can also help you navigate the appeals process if a denial does occur.
Absolutely. Having a skilled billing specialist on your side can make all the difference in successfully appealing a denial.
This has been incredibly insightful. Is there anything else you'd like to add before we wrap things up?
I think the key takeaway is that while the workers' compensation system can be complex and challenging, there are strategies and resources available to help providers thrive. It's about staying informed, organized, and proactive. It's about embracing technology and building a strong support system. And most importantly, it's about remembering that you're not alone in this journey.
Well said. I think that's a perfect message to leave our listeners with. You've got this. The workers' compensation system may have its complexities, but with the right knowledge, tools, and support, you can not only navigate it successfully, but thrive.
And thrive is the key word here. We don't just want to survive this system. We want to excel in it and ensure we're being compensated fairly for the care we provide.
Absolutely. And a big part of that is advocating for yourself. Don't be afraid to question denials, appeal unfair decisions, and make your voice heard. You have the right to be compensated for your services.
That's such an important point. We often get caught up in the day-to-day grind and forget that we have rights too. It's not about being confrontational, but about standing up for what's fair and just...
Exactly. And remember that workers' comp is designed to be a collaborative system. It's not about providers versus insurers. It's about working together to ensure injured workers receive the care they need and providers are compensated appropriately.
Collaboration, that's a refreshing perspective.
Yeah.
It's easy to fall into an adversarial mindset, but ultimately everyone benefits when we work together towards a common goal.
And communication is key to effective collaboration. Keep those lines of communication open with insurance adjusters, case managers, and other stakeholders. Be clear about your expectations and concerns, and don't hesitate to ask questions.
It's about building relationships and fostering trust. When you have open communication channels, you can address issues proactively and avoid potential misunderstandings down the road.
Precisely. And that can save you a lot of time and headaches in the long run. Now, before we wrap up, I want to emphasize something we touched on earlier, the emotional side of this work.
Absolutely. This isn't just about paperwork and deadlines. It's about caring for people who are often going through a difficult time dealing with injuries, navigating the workers' comp system. It can be incredibly stressful for everyone involved.
And that stress can take a toll on providers. We've talked about burnout and compassion fatigue. But it's important to remember that self-care isn't selfish. It's essential.
It's like the oxygen mask on an airplane. You have to take care of yourself before you can effectively care for others.
Exactly. Make time for activities that replenish you, whether it's exercise, spending time with loved ones, or simply taking a few moments each day to breathe and de-stress.
Those little moments of self-care can make a world of difference. They help you stay grounded, centered, and resilient in the face of challenges.
And remember, there are resources available to support. You don't hesitate to reach out to colleagues, mentors, or professional organizations for guidance and encouragement. You're not alone in this.
We've covered a lot of ground today, from the nuts and bolts of Lien Filings to the importance of self-care. What are the key takeaways you want our listeners to remember, Aisha?
First and foremost, knowledge is power. Equip yourself with a deep understanding of the workers' comp system, the regulations, the procedures, and your rights. Stay updated on changes and never stop learning.
And don't be afraid to ask for help when you need clarification, guidance, or support. Reach out to experts, mentors, or colleagues. Collaboration is key to success in this field.
Absolutely. And remember that technology can be your ally. Embrace tools that streamline your workflow, automate tasks, and reduce the risk of errors.
But technology alone isn't enough. You need a solid system in place, clear procedures, a dedicated team, and a commitment to ongoing education.
And perhaps most importantly, prioritize your well-being. This work can be demanding both intellectually and emotionally. Make self-care a non-negotiable part of your routine and seek support when you need it.
Those are wise words. Aisha, thank you for sharing your expertise and insights with us today.
It's been my pleasure.
And to our listeners, thank you for joining us on this deep dive into the time crunch of Lien Filings. Remember, stay informed, stay organized, stay proactive, and most importantly, stay well.
We'll see you next time on Workers' Comp Unwrapped.
Thank you for listening to Workers' Comp Unwrapped. If you found value in today's episode, share it with your fellow medical providers and healthcare specialists. For more information, contact us at lena.klein@medicallienmgt.com or visit our website, medicallienmgt.com.